Hi, I'm Bill Patten, Interim CEO here at Sublette County Health, and I'm giving you a report from the board meeting that was held on February 25th. This was a regular board meeting. At 5:30, the board had an education session that was given by Jeff Hollingsworth from Health Tech, our management company. Jeff went over topics related to our general purchasing organization and supply chain management. He highlighted a number of the savings that we will be experiencing as a result of these changes. The board felt that it was very good education. At 6 o'clock, the board was called into regular session after pledging allegiance to the flag and setting the agenda. The board reviewed consent agenda items. They had one policy from the medical staff to review that they approved, and they approved minutes from the January meeting as well as 2 executive session meetings. There was no public comment during the meeting, and the board then went into committee reports. Tanya Hoffman, our board chairperson, gave a report on behalf of the building committee. She indicated that we are very close to closing out all of the numbers related to the building of the hospital and the Sublette Center. Building of the hospital and the Heritage Home, replacing the Sublette Center. And we hope to close the loan out very soon. We then had a report from Carrie DeWitt with our hospital foundation. She reported that the foundation has done another call for artwork. A number of pieces that we have in the building are donated, but a number of them are being rented. And so the foundation is working to buy a number of those pieces. The art committee had recommended a number up to $20,000. The foundation board had approved that amount. The district board agreed with that, and they also made a motion to approve up to $20,000 to be used to purchase artwork for the hospital and the nursing home. And then Steve Rosenboom did a presentation related to our finances from January. Look for a separate video from Steve on our financial situation. Don Walker gave a report on the Heritage Home. The report highlighted a number of improvements that are being made in the Heritage Home. For example, we are adding a new steam table to the dining room so that we can, rather than serving food cafeteria style on trays, we can serve it more restaurant style or family style, individual served plates. So that was a nice step in the right direction. We're also working on some inspection related paperwork for the nursing home and assessment that Don prepared the board to see in the next month or so. Dominic Sims from Health Tech, he is our Executive Vice President that is responsible for our account. He was here in person last night. It was nice to have him here. He gave an update on a number of topics, including revenue cycle, and he was able to highlight the improvements that are being made in our ability to bill and collect for our services. A number of these improvements being done with the assistance of Health Tech personnel. And then the board approved the normal payroll and bills statement for the month. There was discussion about wage information that some of the county commissioners are wanting us to publish. The board will be taking that topic up again at the March 25th meeting. I plan to work with our legal counsel to make a proposal on what information we might be able to provide, and then I'll present that at a future meeting with the county commissioners. We also had our own Freedom of Information request. It was a company that was looking for information related to any radio towers or cell towers that we might own or lease. Short answer is none. So that was an easy request to respond to. The board then went into executive session to deal with personnel, contracts, and legal matters. To highlight the topics that I presented to the board in my report, I talked about we have made an offer to a HR director. We're now waiting for them to review that offer, and hopefully if we're able to reach agreeable terms, that person will be able to start within about 3 weeks. We have held 7 employee educational sessions. More than 100 employees have attended those sessions, talking about the newly proposed revisions to a number of our benefit policies, our PTO policy, our holiday policy, a new one, an extended illness benefit policy. So the board was pleased that we have taken the time to educate our employees about these new policies. We're planning to take the final version of these documents to the board for approval at a special meeting that will be called in the middle of March. Based on the employee meetings, there are a number of additional policies we're going to be working on. These include PTO donations, CME support for non-provider staff, a without pay policy, and shift differential policy. Unfortunately, our MRI tech is going to be leaving us, and we have, in an effort to recruit a replacement, we have mailed out postcards to all of the qualified radiology techs in the surrounding area. So far, the response has not been very positive. We've received a couple of candidates, neither of them were really qualified for MRI, so we are looking at additional options so that we can make sure we have the coverage needed for the MRI service. That may include using temporary employees or traveler employees. Shifting to the medical staff, the second candidate that we've interviewed for our urgent care, same-day care clinic position has turned us down. Turns out he had accepted an offer from another healthcare provider, so we're going to continue to recruit. We're going to be issuing a press release on this tomorrow, but we announced to the board last night in public session and again to our employees today at their meeting that Raleigh Perry has submitted her resignation. We're very sad to see Raleigh go. We understand her reasons. This is due to issues related to her family. They still own a house back in Idaho, so they're planning to move back. So we wish her the best. We thank her for her service. We have immediately begun recruiting to replace her. The Women's Health Program is an essential line of service for us, so we will keep the community appraised as our recruitment efforts to backfill Raleigh's position move forward. We're also working with our emergency department providers to update quality metric program that we have there. We hope to have that done by the end of June of this year. We've met with our radiology group that reads our x-ray images. We're working on a contract renewal there. We've done a number of, switching to finance, we've done a number of interviews related to our annual audit, and we expect to get the first draft of that audit tomorrow. Once that audit has been finalized and accepted by the board, then we will publish that on our website so the community will be able to see our annual audited financials. And then on the critical access hospital conversion, we had our critical access survey a week and a half ago. We had received the deficiency list. We submitted a report for that this morning, and already by midday, we have received notice that our action plan has been accepted. So the final step now is that CMS has up to 45 days to review everything related to our application. Assuming that they approve it, then we will be deemed to be critical access effective today, February the 26th. And then on the miscellaneous front, we are looking at opportunities to have insurance coverage for our underground diesel fuel tank. Insurance of that type is important just in case you were to ever have a leak from that tank. We're working to expand the capacity of our existing overhead paging system. And then we have completed almost all of the office moves from the hospital campus down to the Sublette Center. That's where this recording is coming from today, my new office down in the Sublette Center. We are now going to start work on the vacated rooms in the clinic. Remember, that's why we're doing this, is we want to create additional capacity in our clinic so that as we recruit more physicians, we'll have spots for them both for their office and also for their exam rooms. So we're going to be working on that right away. And the last thing before the board went into executive session, we talked about a revised contract related to our opportunity to have a helicopter posted permanently on our helipad. This is a service that would come at no cost to the hospital, but would allow for a much faster response time in the event that we need to fly a patient out. It won't change the criteria by which we decide whether or not someone needs to be transferred, but it will improve, once that decision has been made, the time it takes to get the person transferred, because the helicopter will already be here. We won't have to wait for it to fly here. That's a quick summary of the hospital board meeting. I hope you find it useful. As always, give me a call if I can provide additional information. Thank you very much.